Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a boxer. He is a 5 years old boxer who has got a acute renal failure because of the probably systemic infection. He has come positive for E. canis and possibility that he is having a concurrent infection leptospira which has damaged his liver and kidney. You can see the skin is become yellow because of jaundice. So we are doing dialysis for this dog, and I am putting a dialysis catheter. This is a 20 centimeter long dialysis catheter which we are using. 13 centimeter 12 French catheter. This is this is going to, I am going putting little down area so that we can reach little down area. Usually we use in a bigger dog from here to 20 cm which comes here. So this we are starting. So what I am doing, I am just keeping this few things, this center one open because wire comes here through this guide wire, and I don't want to struggle during the procedure. So this is the needle which we are putting before for the guide wire. So I am keeping everything handy for me, everything, and I am just I need to go little up only. This here jugular vein is more prominent. Sometimes it keeps slipping. So now the blood has come. See that? You can see it's not gushing blood because this dog is hypotensive. So I am just putting this guide wire long enough to make sure it passes the needle. So now I put it. After this, I need to, you can make a incision beforehand also, but sometime once you make the incision and if you are not able to pass through that area, then you end up making another incision. So usually what I do, I make the incision after putting this wire. So I am just making it over that area only. Just I am putting inside that area, and I am just making the incision little bigger. Here you can see I made the incision little bigger. Now I am putting the dilator to dilate it, to dilate that area. And being these cases, they will be having all clotting abnormalities also. So we have to be very careful during the procedure also. We should not. So this is dilator, we have dilated that area, and I am just keep holding this area because usually it bleeds, and being I kept it ready for me. If I have an assistant, it's always better, but I am doing this alone right now. So this I am putting inside, and I make sure that this, I should be able to see this at the end, this wire, and then I can just push it inside. So once we push it inside, we can just see that wire is moving. In between also we can see if the wire is not moving smoothly, that means there is something wrong is going on. I am just removing my wire now, and I am going to inject a diluted heparin in the heparin solution and suture it. Can I get 2-0 suture material nylon? So I am going to suture this area, and so I am just taking a bite from here and another bite, little more distally I need to take so that it get a pull effect. And can you see now the skin is going to stay inside nicely. For this dog, being we are doing dialysis, if possible today we will do a small video of dialysis also, that how we set up the dialysis machine. I need to take my other critical care expert, Dr. Amrut's help for that. So both the side we are putting the suture. How much is BP now? 100. Okay. So still BP is low. That's why the jugular vein wasn't getting more prominent, and we have to just hold it from side way and then put that. Normally you don't struggle for jugular vein this much. So in this case what we are doing, we are just pulling little blood first, and once blood comes till the end, I am going to flush it with a saline. Like this same thing I am going to do with this. I am pulling the blood and then pushing the saline inside. Other side also I am pulling the blood and then flushing saline, and then we are going to. Now what we are going to do is, we are going to put heparin inside. It's a pure heparin, and one of these tube they have written for a arterial tube, which is red tube. I need to put 1 cc, and for this blue one venous blood, we need to put 1.1 mm. So I am just going to exactly put 1 ml in this. So it has to go till here, yeah, and in this we are going to put 1.1 mm. So we are going to put till here, and for this we are putting 0.4 ml, because this is smaller tube. We don't want the heparin to go inside too much, so that clotting should not happen now in that area. Now we will close it.